I don't think
Watch
toilet paper is the
this
answer here.
video
I think
and
what
you
we
will
really
learn.
need is I don't think toilet paper is the answer here. I think what we really need is bidets.
Okay.
Yeah. And I know a lot of people in this country are not ready for that conversation.
Explain what a bidet is for somebody who
wow.
doesn't know, because that was another eye-opening experience recently when we
listening
went
to
to a very nice hotel and one of our kids were like, "Whoa, this thing just sprayed me."
Yeah, a bidet is going to change your life. The
Wow,
simplest
yes.
form of a bidet is simply a nozzle that sprays your exterior clean. That's all it can be. Now, that's one end of it. These simple nozzle attachments are like pretty cheap. You can install them yourself. On the other end,
Can you
there are
listen to that?
beautiful luxury bidets where you have a heated seat.
Yeah.
But bidets clean your bum in a way that toilet paper can't. So somebody did this study back in 2023. There was a study that showed that your hands, when you wipe after having a bowel movement, have more microbes on them than people who use a bidet.
Really?
Yeah.
I mean, think about it this way, and I know every parent can relate to this. Suppose you somehow get a little bit of poop on your hand, a little bit of poop on your arm. Would you in that moment consider it acceptable to just like smear it off with a little paper towel and go about your day? No, you would absolutely I hope you would absolutely put some running water on that thing and make sure it was clean. But for some reason, again, with the most delicate tissue in our body, we think wiping's okay. Once you get a bidet.
Okay, let me ask you a question.
Yeah.
Is there a wiping technique? Is it front to front to back? Is it tap, tap, tap? Like, since you not only think, since you know that this is one of the most sensitive tissues.
Yeah.
Like, is there a proper way to wipe?
Of course, there's a proper way to wipe.
I don't know this. Like, what?
Yeah, listening to
I think women are sometimes taught that it should be front to back. And that's the idea is that we don't want to mix the bacteria from our rear end up front to decrease the risk of UTIs, urinary tract infections. There have been some studies that show that that's the case. The best way to wipe up front is a gentle dab. And I think that if you have the ability to do that in the back, that's the best way too. A gentle dab keeps you from creating these microscopic tears, smearing it in. I really think that like sometimes when we're like just scraping our bums, a lot of people have sensitivity in that area. So people who have fissures, who have hemorrhoids, women who are postpartum. I tell all of my postpartum patients this, just a gentle dab is all you need.
And if you see a little bit of blood on the tissue, is that typically a sign of fissures, which are tears around the rectum, or hemorrhoids?
Or hemorrhoids, yeah.
Okay.
Usually if it's like right there on the tissue, it can be. But again, I always love for my patients to talk to me about it immediately because it's easy enough in the office to just like take a look,
Can you
confirm.
listen to that?
If you're having bleeding and there's no hemorrhoids, there's no fissure, we really have to do a colonoscopy at that point.
If this was your partner saying this, how would you respond? Let me have your honest opinion in the comment section. And if you like this video, don't forget to follow for more.